Hi everyone. So this is the last chapter we're covering this semester, and this is focused on challenges for the future. So what psychologists can do differently in terms of encouraging health promotion, stress, promoting health services, helping people manage a severe chronic condition, and some brief trends in health and health psychology. So we're going to look at some major trends in the healthcare system, and it's helpful to remember that even while we still face some big challenges, there's been a lot of progress that has been made. So, for example, world life expectancy is now around 71 years of age. Cancer deaths in the US have been declining since 1990s. Fewer adults have high cholesterol than they did 20 years ago, and smoking rates have dropped by more than half since 2000. At the same time, not all trends are moving in the right direction. So we do see that cardiovascular deaths in the US have been rising again since 2020. And this is likely due to factors related to the pandemic, such as increased vulnerability, delays in care, and disruptions in healthy habits. These changes, along with the widening racial disparities, show why we still need to pay close attention to emerging health problems. All of this makes health psychology especially important right now. So, the field helps us understand how our thoughts, behaviors, and social environments affect our physical health. And research continues to show strong links between psychological processes, inflammation, and chronic illnesses like heart disease and depression. Health psychologists not only develop interventions to help people live healthier lives, but they also contribute to public policy and prevention efforts. We also see advanced technologies now. So technology is transforming healthcare, anywhere from smartphone apps that remind people to take medications to telemedicine visits that make care more accessible. Even robots and AI tools are beginning to play roles in supporting patients and improving care. So, overall, the combination of scientific progress, advanced technology, and behavioral research is making this an exciting and important time to study health psychology. Advances in neuroscience over the past 25 years have been incredible, and they've helped us better understand how our thoughts, behavior, and social environments affect our physical health. As neuroscience continues to grow, so does the field of health psychology. But these exciting developments also come with challenges. Many lifestyle issues like not getting enough exercise or sleep or eating poorly are very hard to change. They can become habits, but it's also important to understand that a lot of times it's access to change. So, socioeconomic status can play a huge role in who gets sick, who gets care, and who faces the greatest health risks. It's important to understand that having a lack of food security also plays a role in who is able to change their behavior. So it's not just about behavior change at the individual level, but also at other levels like healthcare policies. Um, so effective health interventions can't rely fully on behavior change. They also need to be supported by policies that reduce income inequality and improve access to care. People used to believe that simply educating patients would solve most health problems, but now we understand that education is only the first step. Even educating healthcare providers hasn't been enough to create the level of change we hope for. So, to truly improve health, we have to look at the healthcare system as a whole. We have to look at people's access to that healthcare. And so, because many providers still aren't fully aware of the tools and strategies that health psychologists can bring to the table, it's more important than ever for psychologists and medical professionals to work together to provide patient centered care that integrates both behavioral and medical approaches. In health psychology, there's a growing focus on figuring out which parts of behavior change programs work the best so we can build interventions that are effective, affordable, and able to reach as many people as possible. We're already seeing more interventions designed for large audiences, whether that's online, in workplaces, or in schools, or even throughout the community. One challenge, though, is keeping people engaged long enough for these digital programs to make a difference. Research shows that interventions guided by a health professional, like getting feedback or support through calls, texts, or messages, tend to work better than programs people do completely on their own. Electronic interventions that include tools like goal setting, self monitoring, feedback, reminders, rewards, and social support also seem to boost engagement. As we continue to learn more about the biological, psychological, and social factors that increase someone's risk for chronic illness, helping people who are at risk becomes even more important. These individuals need support in understanding their risk and changing the behaviors that can still be modified. Studying at risk groups helps researchers identify additional risk factors and understand why some people develop a disorder while others do not. It also helps highlight protective factors, so things that reduce the chances or severity of illness, which are just as important, but they're often studied a lot less. And so health psychologists play a key role in all of these efforts. But the main role is to identify these precipitating or promoting factors of these disorders, and then trying to figure out how to change certain health policies to prevent those people from actually getting ill or sick. So now we're going to talk about preventing illness early on and trying to incorporate health promoting habits early. So preventing unhealthy habits before they start is a major goal in our healthcare system, and health psychologists play an important role in this work. Adolescence is a time when many unhealthy habits begin. So teaching kids early is key. Programs that introduce fifth and sixth graders to anti-smoking or anti-drug lessons can help stop some teens from developing these behaviors. For other health habits, we need to begin even earlier by teaching parents how to keep their children safe. So this includes preventing injuries at home, using proper safety practices in cars, and helping kids build healthy routines like exercise, eating a balanced diet, staying up to date with vaccines and doctor visits, and taking care of their teeth. So it's important to help children practice these health promoting habits early, so that they develop them early, and it reduces the onset of illness later, and it can help reduce unhealthy habits. So, not a surprise, but the world's population is getting older. So, the percentage of people ages 65 and older has doubled since 1960, both globally and in the US. And even so, many people still hold negative stereotypes about aging. So, there's still stigma associated with aging. These stereotypes often make aging seem like it's mostly about decline, but research shows that this is not true for most older adults. Yes, there are some older people that experience health, social, or memory challenges, but many of these issues do not appear until the late 70s or 80s. There's also a lot of variation among older adults. So, healthy habits like regular exercise help people stay active and independent, even in older adulthood. So, it's important to try to address harmful stereotypes about aging and older adults. There's organizations like the National Center to Reframe Aging. They work to promote more accurate views of aging. There's programs that support healthy behaviors, so helping older adults get more physical activity, educating them about nutritious eating, participating in mentally stimulating activities, and limiting alcohol can all help them maintain the highest level of functioning possible. And so interventions are available that emphasize diet, exercise, control of alcohol consumption, and reducing negative stereotypes about aging and older people. So in order to promote health and prevent disease, we need to shift some of our health promotion efforts. In the past, we focused more on reducing mortality than on reducing morbidity. Mortality is related to death rates, and morbidity is illness and health problems that people live with. So focusing on morbidity is important for several reasons. And one major reason is cost. Chronic illnesses can last for many years and they're very expensive to treat. So for example, conditions like rheumatoid arthritis and osteoarthritis do not usually cause death, but they greatly affect daily functioning and quality of life, especially for older adults. So helping people stay healthy and free from chronic illness for as many years as possible improves their well-being and reduces healthcare costs. So looking ahead, public health needs to create interventions that target multiple health risk behaviors at the same time, focus on helping people maintain behavior changes long term, and lastly, connect individual behavior change strategies with larger environmental and policy supports. So recently, researchers have developed just-in-time interventions, which aim to deliver the right kind of support at the exact moment that somebody needs it. These interventions adjust to a person's changing physical and environmental cues. So for example, a stop smoking message might be sent to someone right after they are diagnosed with bronchitis. So thanks to the internet and our mobile technology, personalized interventions are becoming easier to implement and are becoming more common. So in order to promote health, we also need to place emphasis on promoting resilience and reducing health disparities. So let's talk about resilience first. So resilience is the ability to bounce back from adverse events, like stressful life events or negative events that happen. It's important to strengthen people's ability to build and maintain social support and increase their resilience, which also includes seeking out opportunities for self-care, rest, renewal, and relaxation. And these insights can help create more effective interventions. Also, personal strengths like optimism and a sense of control have been shown to protect against chronic illness. And so it's important to understand that these skills could be taught and strengthened, and they can help reduce the risk of chronic health conditions. Also, changing individual health behaviors is important, but again, it's not enough to improve the overall health of the population. We also need systematic change. So even though the US spends more on healthcare than any other country, we don't have the best health outcomes. So in fact, compared to other wealthy nations, the US ranks last in healthcare quality. And a big reason is the large socioeconomic differences in health and access to care. Health risks start early in life, and they often happen during childhood and adolescence. And low SES, which means having fewer financial and social resources, has long-term effects on a person's health. Adults with low incomes or no insurance, they often struggle to afford health care, and many people skip or delay treatment because of how expensive it is. The US healthcare system also relies heavily on for-profit private insurance companies, which contributes to unequal access to care. Low SES is linked to many health risks like higher alcohol use, smoking, obesity, and high cholesterol. And because of this, people with fewer resources are more likely to get sick or develop chronic diseases. Interventions that help low-income individuals reduce this risk. So programs targeting smoking, substance use, diet, and alcohol use are very important. But large-scale structural changes like universal healthcare coverage are critical for reducing this inequality. And so we do need a universal healthcare coverage system. There's also major racial and ethnic disparities in health. So for example, Black Americans and American Indian individuals have shorter life expectancies than white Americans. Infant mortality rates are much higher in these groups, and maternal death rates are highest among Black and American Indian Alaska Native women. Black Americans are more likely to die from illnesses like cancer, heart disease, diabetes, and COVID-19. And these differences are influenced by factors like low SES, limited access to healthcare, and discrimination. Gender differences also matter too. So for many years, women were left out of medical research studies, meaning treatments were often tested only on men. But this has changed due to new guidelines that require both men and women to be included in clinical trials. Again, these effects of this past gap still influence healthcare today. Women's healthcare is fragmented, where they have to see multiple specialists for their healthcare needs, unlike men. They're also less likely to have health insurance than men. And women are not included as research subjects in a lot of studies of many major diseases. And so this can reduce the generalizability of results to both men and women. And so because stress takes a particular toll on women, health research really needs to focus on women that have major diseases as well. So over the past 40 years, researchers have made big discoveries about how stress affects the brain and the immune system and how it can increase inflammation. We now know that stress can seriously impact health, and certain stressors like even noise, crowding, or unsafe environments can harm vulnerable groups. Research has also shown that experiencing adversity in early childhood can increase health risks later in life. There's been a lot of studies on workplace stress, and they have identified job conditions that increase stress, such as having too much work, too little control, and no social support at work. And so as a result, many interventions now focus on redesigning jobs and improving working conditions to reduce stress. Future research is also likely to focus even more on the biology of stress, such as how stress hormones work, how the nervous system responds, and how stress affects the immune system and inflammation. Scientists are also studying how certain patterns of gene activity contribute to health problems. Understanding these pathways can lead to more advanced, targeted stress reduction interventions. Research has also shown that depression and negative emotions can worsen chronic illness like heart disease, diabetes, and stroke. So understanding how emotional states affect health will continue to be a major research priority. One of the strongest findings in the stress research is that social support reduces the harmful effects of stress. As more people live alone, marry less, move frequently, or experience a loss, building and maintaining supportive social networks is becoming so important. So to reduce stress and improve health, society needs to focus on decreasing social isolation, promoting healthy social connections, reducing stressful environments like high-pressure workplaces, and making sure that support reaches those who need it the most. It is also important to teach people how to give support and not just receive it. Helping others through kindness, encouragement, or emotional support can benefit both the person giving it and the person receiving it. And while this does not apply to extreme caregiving situations, moderate levels of helping can improve well-being for everyone involved. Because chronic illness is a major health concern, programs are needed to help patients deal with their problems posed by chronic illnesses. So there needs to be a system in place where resources are widely available. Health psychologists should help create responsible and informed consumers by promoting education on illnesses and illness prevention. Patients should partner with healthcare practitioners and deal with their disorders, and health services accommodating the poor should be developed. Decades of research show that many people who are sick never make it into the healthcare system, and more than half of those who do seek care have symptoms tied to psychological stress. Health psychologists help people become informed healthcare consumers by explaining health science early, correcting misinformation, and helping patients and providers work together. They also support physicians in improving communication with patients, Because treatment only works when patients follow through, health psychologists study why people struggle to stick to treatment plans and develop strategies to improve adherence. Being a good healthcare consumer means protecting public health by doing things like getting vaccinated, donating blood, or agreeing to be an organ donor. A major goal is improving the quality of life for people, especially for those with chronic health conditions. So it's important to undergo early assessment and ongoing check-ins to identify problems like anxiety or depression before they become worse. There are social factors like how well people engage in daily roles and activities, and that can give a fuller picture of a person's well-being. And because psychological health affects physical health, interventions that ignore mental health and social functioning are unlikely to make a meaningful impact. So, although the COVID-19 pandemic has ended, long COVID does remain a concern. So many people continue to experience long-lasting symptoms like fatigue, pain, mood changes, cognitive issues, or breathing issues. And about 6.2% of people worldwide develop at least one of the symptom clusters, and recovery can take months. So getting vaccinated reduces the risk of long COVID, and health psychologists are studying both the causes and potential treatments for these symptoms. In addition to that, the aging population presents challenges. So health psychologists have to consider where older adults will live, what resources they will have, and how those resources influence their health and healthcare access. As more and more people live longer with chronic illness, there's some ethical questions that surround end-of-life care, such as assisted death, living wills, and family decision-making, and these are also becoming urgent. So health psychologists are continuing to play an important role in guiding individuals, families, and healthcare systems through these difficult issues. So new medical technologies have helped improve healthcare, but they have also contributed to rising costs and can feel confusing or intimidating for patients. When providers explain how these technologies work and help patients feel more in control, it can reduce anxiety and make treatment feel more manageable. Technology also creates opportunities to reach people with proven health interventions. So programs for healthy eating, building social support, quitting smoking, or reducing depression through online tools can be super helpful for people. And it can also be pretty effective in reducing the risk of chronic health conditions. There's decision making in healthcare, which can also be overwhelming. So for example, older adults choosing a Medicare Part D prescription plan may face more than 30 different options, and so it can make it hard for them to know which one is best. Health psychologists working with economists can simplify these choices by creating clear and easy to use decision tools that help people make better healthcare decisions. More comprehensive intervention models are now being used to treat people with several bad health habits and disorders that need to be addressed simultaneously. They are also tailored to the individual needs. So now, because there's so many individual differences in health behaviors, it's important to develop an intervention model that is tailored and customized to individual needs and habits. They can be employed for concerted attacks on risk factors, community and societal level interventions that enhance motivation are a form of public health management. Attention must be paid to cost effectiveness and treatment effectiveness when it comes to interventions. The world's population has grown from 2.5 billion in 1950 to over 8 billion today. Different countries face different health challenges. So in many poorer regions, high rates of infectious diseases are linked to poverty, limited education, and a lack of healthcare resources. So there's low literacy, and low health literacy can make problems worse. Smoking has decreased in the US, but it is increasing in many other countries. And as some nations modernize, people are becoming less active and losing the health benefits of daily physical activity. There's also many developing countries that are now facing the same major health issues as developed countries. So chronic illnesses like heart disease, stroke, and chronic lung disease are now the leading causes of death worldwide, aside from COVID-19. So this means that basic primary care is becoming critical everywhere. Telemedicine can help doctors reach people in remote or crowded areas for initial checkups, but long-term care for chronic illnesses is still difficult to access in many places. Health psychologists play an important role by understanding cultural values, social norms, and community structures. These cultural factors influence how people think about their health, what treatments they trust, and whether they follow medical advice. Because of this, an intervention that works well in one country may not work well in another. So, by paying attention to cultural differences, health psychologists can help design more effective health programs and improve global health. So this last slide focuses on how to become a health psychologist if you are interested. But for health psychology, you would have to take undergraduate level health psychology courses and develop knowledge about the biological basis of behavior first. And then you would apply for graduate school and decide whether you want to pursue research, clinical practice, or both. You would then get hands-on experience. You would take courses in research methodology and statistics. And then you would try for a field setting in a health maintenance organization. You would then take a licensure exam and get licensed to practice if that's what you wanted to do. Or you could go into research entirely and complete a major research project for your dissertation. Then you would go on to doing postgraduate work and get postdoctoral training, where you would identify the gaps in your training and the type of postdoctoral training you want to opt for. There's a lot of opportunities for employment in health psychology. They typically work in an academic position, but you could also work in private practice. You could work with medical patients in a hospital or other treatment setting. You could also be a consultant to a workplace, or you can work with a governmental agency. And so there's a lot of different employment opportunities for psychologists looking to go into the health field.